What is records access, and what exactly are the benefits of records access for you as a patient? Well, first of all, records access allows you, the patient, to be able to access your medical record over the internet from wherever you may be. That may be whilst you're at home, but it could well also be whilst you're at the out-of-hours service, for instance, or the casualty department, or the outpatient department, or perhaps whilst you're on holiday on the other side of the world and suddenly fall ill and would like the doctor or nurse who's looking at you to be able to see your medical record. Of course, it doesn't have to be a clinician. It could be a friend of yours, a family member. It could be anybody, so long as you are happy for them to see your medical record. And what can you see? Well, you can see a summary of your medical conditions, including any significant active problems, as well as perhaps any past problems that you've suffered with in the past, any operations that you've had, any other conditions. Not only that, you can see any consultations that have taken place within the GP surgery, so long as it's been recorded on the clinical system electronically. You can see any medications that you're on, as well as past medications that you've had in the past. You could see any test results you've had. That may include blood tests, it may include things like x-rays or ultrasound scans or any other tests that you may have had. Not only that, you can also see any letters that have been sent back to the practice from someone else, for instance the hospital, or perhaps a podiatrist, or perhaps an optician, etc. So you can see consultations, you can see blood results, you can see medications, you can see any allergies that you may or may not, that you may suffer with. You can see any letters that have come through. These are all the things that you can do with records access. So you might now ask, well, what are the benefits of accessing your medical records? Well, firstly, it's a free service. It doesn't cost you, the patient, anything at all in order to access your medical records. All you need is access to a computer and be able to, and the internet. I say access to a computer. Many patients often think that means they have to buy a computer themselves. Of course, that's not true. Most libraries have internet access for the public, so you don't have to have your own computer. You can go to a library and you can log onto a computer as long as you feel happy to be looking at your medical record in a public place like that. So it's a free service. Secondly, it's immediate access. What does that mean? Well, that means as soon as any information drops into your medical record, you are able to see it as well if you log onto the computer at the same time. There's no time delay. As soon as the information is scanned onto your medical record, it's available for you to see 24 hours a day, 7 days a week. The system that we have in place is as secure as internet banking. What does that mean? Well, that means that it's as secure as people that do their banking over the internet. At the moment, this involves putting a password in, and then secondly a passphrase in order for you to access your medical record. We have plans in the future to also possibly offer Secure ID, which is a little gadget that produces a 6-digit number that you also have to type in, and that number changes every 30 seconds. More about that later. The most important thing about this system is that you are the person who has the passwords and the passphrases. You type them into a website, into a secure website, and only then are you able to see your medical record. Because of this, only you can decide who else sees your medical record. You type the passwords in and then you can let someone else see that medical record, be it another doctor, another nurse, another friend, and so on. As I've said before, you can view your own clinical record, you can see the results, you can see letters, and you can decide who you share your medical record with and who you don't. You may well find when you're looking at your own medical record that there may be mistakes in there, or perhaps there's omissions, something that we've missed out. Again, this is your opportunity to ensure that your medical record is as correct as possible. If you find mistakes, you can then inform the practice and we will look into it and if need be correct your medical record. Even better, Often when you come to see the doctor or nurse, we might give you advice about how to improve things or improve your health in general. There may be advice there about stopping smoking, or perhaps reducing your alcohol intake, or even perhaps advice about how you might be able to lose weight or increase the amount of exercise that you're doing. All these things, little gems, are in your medical record that you may have forgotten about. But if you could access your medical record, you'd be able to see that, and perhaps what you can do to try and help improve things for yourself. Wouldn't that be great?